this case, it's the APC gene, which is a tumor suppressor gene downstream of the Wnt signaling pathway, which is key in the cell signal transduction pathway, important proliferation of cells. Again, this mutation is also found a lot of time in sporadic and non-inherited patterns. So here's a table, just quickly about Amsterdam criteria, the Bessa criteria. I'm not going to go over this too much. If you're interested, just talk to Emily for a handout. I think this is a good reference. In addition to the familial syndromes, there's also inflammatory bowel disease, such as ulcerative colitis. Ulcerative colitis poses a 5 to 10% increased risk of colon cancer by 20 years after time of diagnosis. In addition, Crohn's disease, the risk is not as high as in UC. However, if there's colon involvement in Crohn's disease, there's also likely increased risk of colon cancer. And just history of having polyps alone poses a 3% increased risk of colorectal cancer. And I think a lot of you are primary care physicians. Is that correct? No. Well, I think this slide here, a lot of you probably might be familiar with already. So just quickly going over the screening recommendations. Fecal blood testing is probably still the most common way used in primary care setting. And this is recommended annually to be done on patients age 50 or older, and it's been validated by clinical trials to reduce colorectal cancer mortality by 1/3. However, people with positive fecal blood, fewer than 10% actually have colon cancer, and only about 1/5 to 1/3 have polyps. Next thing